Hey everyone, Happy New Year, or as the Dagomba would say, Niti Yumpali. To summarize very briefly some of the things we've done in 2015 and some of the things we hope to do in 2016, I'm wearing the Songtaba shirt for the event we helped Songtaba plan for the International Day of Human Rights, part of 16 Days of Activism. We got together some local paramount chiefs and sub-chiefs, and they denounced mob violence against women accused of witchcraft and called for women who have been cleansed after accusations of witchcraft to be allowed to return home. That event was really successful. You could see another one of the shirts here with my favorite of the slogans that we helped write. Mob justice is injustice. I stand with the chiefs to protect alleged witches. Like I said, this one's my favorite, but this is a white shirt, and I have the hardest time keeping any color other than black clean in this dusty Harmattan weather. What have we done for Songtaba? We've been working with them behind the scenes to develop their strategic documents for the next 5 years, a sort of roadmap moving forward. We've been analyzing all of the data that they've collected in the communities where accusations of witchcraft most frequently occur so that we can identify some possible initiatives moving forward that will change the circumstances so fewer accusations occur in the future. We've also been developing projects for Kukuo, one of the camps for alleged witches, so that as we work to stop future accusations, we also improve the lives of women who have already been accused and whose rights have been abused as a result of those accusations. So that's some of what we've done in 2015. In 2016, we're going to be building on that foundation in some really exciting ways. We have a medical records project moving forward in Kukuo, that camp I just mentioned, where we will be implementing a new structure, a new health record structure, so that for the first time in their lives, the residents of Kukuo will have access to their health information in a language they understand. We're going to be creating records in Dagbanli and in English. And then we're going to be filling those records by providing free health screenings to every resident of Kukuo. We want to, at the very least, make it so that individual patients know what their health histories are, and so that the people who serve them know what those health histories are. And we think that by putting that sort of system in place, people will be more likely to access the healthcare system, and the service that they receive when they access the healthcare system is going to be improved, is going to be more individualized, more specialized. So anyway, that's one of the projects. We also have a water project that we will be rolling out in 2016. Initially, it was supposed to be a clean water project. It was going to be a filtration system. Fortunately, we're not disappointed by this news. The government, unbeknownst to our partner Songtaba and even to many of the leaders in Kukuo, had arranged to drill new boreholes for Kukuo and then mechanize or pump water from those boreholes to Kukuo. And those new boreholes have been tested, and the water in them is safe. So as long as the pumping is done in a secure way, in a safe way, then the water that reaches the community will also be safe, meaning that the filtration system we had planned isn't going to be necessary. It's okay. We put a lot of work into it, and we're proud of the work we did. That work will still be able to be used in other communities with similar problems, and we do plan on expanding to other communities after we've addressed Kukuo's water situation. So what are we going to do instead? Well, the government and the people of Kukuo have suggested that though the water will indeed get there and it will be safe once it gets there, it's possible that the contract that they've put out for this project won't actually distribute the water throughout the community. It will get it to one main holding tank, but Kukuo is a community of more than 1,000. It's almost 1,300. So one distribution point for 1,300 people is dramatically insufficient. So we're looking at raising money to further distribute the water from that one main holding tank to different quadrants of Kukuo, and I'll be updating you about that in the future. We're going to be bringing more volunteers on board to continue the clean water and the medical work. But then there's some exciting new directions we're looking as a result of that research that I mentioned from 2015 related to decreasing the incidence of future accusations. We're going to look at some women's empowerment projects through agricultural entrepreneurship, through group savings programs, possibly through some microfinance programs. We're hoping to launch a malaria prevention program. We are looking at some education programs. Songtaba runs the Complementary Basic Education Program in the Nanumba North and South districts, and that is a fantastic opportunity to increase gender parity in education in the northern region, and so we are looking at ways that we might be able to support those efforts and other ways as well. We can really only move forward with this work, though, with your support. We've only gotten this far with your support. So as we move into 2016, I humbly request, plead, beg, not on my knees, but thought about it for a second, that you sign up to become a recurring donor for the Humanist Service Corps. You can do that in the links below, and it's really those sorts of recurring donations that allow us to plan for the future. There are a lot of projects that we want to do, and the limitation on the number of volunteers we can bring is not related to the work, it's not related to the space, it's not related to anything logistical aside from money. It's looking like we're going to have to turn away qualified, highly skilled volunteers every year, Ghanaian volunteers and non-Ghanaian volunteers, and the only way we can change that is if we get enough people signed up giving regularly. So please, please, as your first charitable act of 2016, consider starting us off. Make it 12 donations to HSC this year, once a month, and at whatever level you do that, it will be a great aid to this program. A brand new program which honestly is doing some incredible work. If you haven't followed along with that work so far, that will also be in the links below with some highlighted articles and posts from 2015, and also some writing about what we hope to do in 2016. Thanks for watching, and here's to a wonderful and impactful 2016. All right.